You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. We're talking about what's new in cosmetic dentistry. With us, we have an expert on the topic, one of the busiest dentists in all of the United States, Dr. Brewer. Dr. Brewer, welcome to the program.
Thanks, Randy. I'm glad to be here.
And now we've had you on the program before, by the way. So, we've wanted you back for quite some time, but a lot has changed since then. And before we get into today's topic, I know you brought a lot of photos. Your practice, I mean, you guys really are one of the busiest in the U.S., right? I mean, some people say the busiest, the biggest center.
We are. A lot of the practice management consultants out there say we are the biggest right now for a single office. Remember, we do employ 10 doctors, 10 to 15 hygienists. It's big. And our claim to fame is that if somebody calls us in the morning, we will get them in that day, guaranteed.
Is that right?
And we can do it. We've never failed. As long as they're willing to take the appointment available, we can guarantee getting them in.
People say that, and I don't go to the dentist very often, but the people say, hey, it takes 2 weeks to get in another place or a week to get in another place.
We have them coming from Wyoming and North Dakota, all over eastern Montana, because they've been told that it would take them 2 weeks to get in.
Okay, you're also a training facility. Is that correct? I mean, doctors from all over the country, sometimes 25 at a time, learn the art of cosmetic dentistry, et cetera, dental implants from you guys. Tell me a little bit about that.
I would say one of the most enjoyable things that I do in dentistry is to teach. We've got the 10 doctors on board that I teach and I share my knowledge with them, but we bring in now doctors from across the United States. In October alone, I think we had 40-some doctors come in.
And what do they do, by the way? They just kind of shadow you a little bit?
They do. They shadow. They have lectures actually from various team members. Our team leads give them lectures. I lecture to them, and we teach them everything from practice management to efficiency to details of how we might do a particular procedure, and it's very enjoyable, and it's my time to give back. In the past there have been doctors that have taught me, and it's my time to give back.
All right, now the procedures you do, I mean the type of practice, tell me who the typical patient is and what are the different procedures you do.
Wow, it's cradle to grave. I mean, I'm not kidding you, from the tiniest children to the oldest individuals. I did root canal post and crowns on a 101-year-old lady. She was telling me how close she is to 102. Last week, I also did implants on a 92-year-old lady last week.
Interesting.
So everything from orthodontics to everything under cosmetic to implants, veneers, dentures, we do it all. It would be quicker to tell you what we don't do.
Okay, and you guys do IV sedation?
We do IV sedation, so if we are doing a huge case, and some of the cases that I'm going to show you today will be done under IV. In fact, the first case I'd like to show you
Let's take a look.
Was done under IV sedation. This guy was terrified. What I want you to see in this photo is the state of the teeth. There are virtually no back teeth available. You can see where the little implant stubs are.
How old is that person, by the way?
He's about 45 years old.
Right?
He's a business owner.
That's got to be, I mean, is that unusual?
It's not unusual for me, but I think the average person doesn't ever see this because this person doesn't smile.
Okay, good point.
He's totally inhibited, he's embarrassed, and he's embarrassed to come to me. But his wife said that she had never seen him smile. And now to have him smile, his son is so thankful. Everybody in his family, feel that we have, in some sense, changed his life.
So what did you do for him?
So basically, we replaced his back teeth with restorations on implants. So it's a combination of extractions, root canals, and restorations on implants. So it's a little bit of everything we do. So what I want to let you know is this guy was not only embarrassed about his smile, but he was in pain. He had difficulty chewing. For him to eat a burger was nearly impossible.
Okay.
So what we were able to do, and I'd like to show you the after. So here, what you can see is he's now smiling. But what I want you to see in that photo is that it's a crooked smile because he's still a little bit embarrassed. He really hasn't figured out how to smile properly.
They have to learn how to smile?
But in his before smile photo, it's like open just a couple millimeters. And now it's open 10 to 12 millimeters. In every case I'll show you, you'll see that.
Now, when they see their teeth for the first time, by the way, I mean, you've told me in the past, pretty emotional for some of these people.
Some of them cry.
Is that right?
It's absolutely amazing. Some of them cry. And sometimes I'm not really good at reading, especially the females. I'm not good at reading it. I'll have to ask my assistant, good cry or bad cry? It's invariably good cry, and it's so rewarding.
Now, very interesting. I'm looking at these photos, and I want to ask you: these people that come in their mouths are kind of a disaster. How many years usually are they miserable with their teeth before they finally do something?
I think some of these people half their lives. In other words, the number of 40 to 50-year-olds, even 6-year-olds, they've been miserable half their lives, and it's usually some point takes them to making a decision to do something.
Like the straw that broke the camel's back kind of a thing?
Yeah, I'd like you to look at this photo with me. So I want you to look at her front teeth. They're brighter and white, but if you look at the tooth off to the side of it, it's set back, it's crooked, it appears darker. And this lady is into photography. Her husband's one of the top photographers in the state of Montana. They're friends of mine. And she came in to me and she said, I don't like this. She showed me this picture and said, I don't like it, and I want something done about it.
So when you look at that, I mean, when you see a smile like that, do you say, oh, this is going to be easy, this is going to be good, this is going to be a great result? I mean, what goes on in your head when you see a patient like this?
What goes on in my head is, what are my options? So, I have to make a differential diagnosis or an option diagnosis as to what can be done. And then I want to tell her the pros and cons to that approach. But in her case, I call this instant ortho. In other words, because one of the options that I have to give her is orthodontics and do braces.
Instant orthodontics for you is what? Putting like veneers over?
It's a combination of veneers or crowns. It's all porcelain. There's no metal in these restorations, so that they're beautiful. And basically, I'd like you to look at the after picture. You're going to see straight teeth, and you're going to see white teeth and in perfect size and proportion.
Wow. That's a big difference. I mean, when you put those side by side,
it is. Yeah. Put them side by side, and it's just incredible. What I'd like to show you is the level of sophistication that I see in her. She is an absolutely beautiful lady. She has a beautiful personality. But when you look at the after effects with the new teeth, I think she is just so much more beautiful, and in my opinion,
it does. I mean, you're right.
Confident.
Sophistication is a good word for it. I mean, she definitely looks like a little bit more put together.
The package is complete.
Refined, as they say, on this. Very interesting. You say you see changes also in personality. That means you fix her teeth and they act differently.
Oh yeah.
Is that right?
Absolutely. And in fact, I'll see people even get promotions, and I'm thinking to myself, well, I wonder if I had something to do with that. So it's really neat. I want to show you another photo. This next gentleman, basically just genetically born with what I would call little teeth and missing teeth, and very handsome gentleman, great young kid. And if you look there, I mean, he's got a smile, still a pretty good looking guy.
Yeah.
But I'll tell you what, talk about completing the package. He really looks like...
Big difference. Put them side by side. Let me see.
Yeah, let's have those side by side.
All right.
And is that something? There's a guy with confidence. I tell you what, the gals in my office see him, and they just think he's one of the handsomest guys around.
And they must want to smile more, by the way. Kind of flash their smile more. And
every time I look at the interlip distance on my before and afters, I don't think I'm going to show you a case today where the smile isn't bigger in the after, and there's no coaching on that.
So in this economy, though, how are people doing this?
Absolutely.
As far as cosmetic dentistry.
Absolutely. It's an investment in themselves, and they realize that if they've got that brighter, more positive smile, they have a better chance of advancing in their company and getting that better job.
Really? You believe that?
Yeah. Here's a perfect example. This very next case, this is a set of veneers that were done by another doctor.
Okay.
And this person, they're okay. They look fine.
It's a good set of teeth. Looks pretty good.
But I can tell you that they weren't bright enough for this day and time, because now we're going with quite a bit whiter teeth. And I didn't like the shape. They were contoured not the way I would have done them. And this is what her full face looked like.
That's on the before.
That's on the before.
And she didn't like those teeth?
She didn't. And she realized she actually knew what we could do, because she'd talked to other patients that had seen us.
Okay.
And now I want you to look side by side with the after.
Very nice.
And you'll have to agree that it looks so much better. The porcelain that was used is a better color. It has more translucency. The relationship of the teeth is better. They really had more of a triangular shape, and she needed something more rectangular or trapezoidal.
And all veneers aren't created equal, you're telling me.
Oh, they really aren't.
And some guys are using,
well, a laboratory technician that really isn't up to the proper skill. In other words, as brilliant a dentist as I might try to be, the laboratory technician can make me look good or bad.
So to make the teeth look real, is that what we're talking about?
That's what we're talking about. Yeah, the contours have to be anatomically in the proper relationship and proportion, because if the light doesn't reflect off that tooth like a normal natural tooth, people immediately label it fake.
Yeah, because I feel like I could spot, respectfully.
Yep,
but I feel like I could
absolutely.
spot veneers walking down the street.
Absolutely.
So you're saying that's in the hands of the dentist? if they
It
made
is.
some fake-looking veneers?
Well, it's the dentist has to choose the laboratory technician. The laboratory technician can make the dentist look good or bad.
So you have a specific person that you use?
Absolutely.
Every time?
Absolutely.
Okay, good. Okay, good.
So
We have time for a few more.
I don't have.
What else you got? These are dramatic photos. I mean, do you guys call them smile makeovers? I mean, what do you call them? Do you guys have a lingo for this?
Yeah, it's smile makeover. Some of these cases where we're restoring the entire mouth, we call it full mouth reconstruction. It's just a big term that that sounds comprehensive.
So even if somebody's watching this and saying, you know, I'm too far gone, they could still have a great smile.
Oh my gosh, yes. We take people.
Some of these are really disastrous.
We take people that look absolutely unsavable and totally reproduce a new look.
Okay, good.
Well, I'd like to show you this gentleman. He's been with me 28 to 30 years as a patient, and he really wasn't in the market for cosmetic dentistry. The thing of it was, as you look at those teeth, they're chipped, they're broken, and we're constantly having to restore them. Well, he wears a sleep apnea appliance, and he gives us credit, by the way, dentistry for, you know, actually being able to help save his life, because the CPAP machine was not working for him. And so he's one of these guys that would wake up every night and not be able to breathe. Now he wears an appliance that we've built for him, but every time his teeth would chip, then the appliance wouldn't fit, and it was just getting to be a pain. So we made a new set of teeth. If you look at the before and after, here's his
Let's take a look at this.
Full face before and full face after.
It's very nice. And by the way, on the after, very natural look.
Very natural look.
Very nice.
And
you
not
know, too white.
And like I said, he really wasn't all about it for the looks. He wanted those teeth restored because he had to have that sleep apnea.
So what did you do to him, by the
appliance.
way, when you say you fixed his teeth or restored his teeth? What did you do?
Well, first of all, when a person's got a lot of breakdown, I use the strongest restoration I can, because an old timer taught me years ago that if he's going to break the front teeth, his natural front teeth like that we need to build him the strongest tooth available, which is porcelain fused to gold. So that's what his are, porcelain fused to gold. They look beautiful. We did top and bottom. So his new smile is all the front teeth are just gorgeous porcelain.
Yeah, it's very, very, very nice. And people are doing, like, you know, improving their smiles in their 70s.
Yeah.
And 80s. Because 70s is young today.
Yeah, and
right?
but what I'm pointing out is, you know, it is young, and they need to go the distance. The lady that I was telling you about, the 102-year-old, she wanted to always say she was 102. She's like, little children will want to tell you that they're 5 3/4 or whatever. That's the way she was. I'm 101 3/4.
Okay.
So the 102-year-old, she said, well, when I was 90. I thought, well, I'm not going to live that long. She goes, well, now that I got these badly broken teeth, I guess I need to fix them. So at 101 3/4, we're doing root canals and restoring her smile. It was very rewarding. The next one I want to show you, this lady was in sales with me, and I actually talked her into restoring her teeth, because I thought to myself, gosh, you would be the perfect candidate.
So she's like a rep that calls on you.
Yeah, she's a rep that calls on me, and I said, you know, so I gave her a discount. I knew it was so important. I actually gave her a discount. Let's take a look at the before.
What's wrong with that? I mean,
you know,
other than the obvious.
Beautiful, young, enthusiastic woman, but the teeth were too small. They had spaces. They weren't the right color. They were irregular. And now if you look at the after with me, now we've got a beautiful woman here.
Yeah.
And
she looked like a kid in the before.
Looked like, yeah. It makes a dramatic difference.
Or a teenager.
And you know, so she went from being my local rep to now being the head of her department, and you know.
Yeah,
so
I mean, you think it's because of the teeth?
Well,
no,
you
I'm
know,
not laughing. I mean, but do you? I mean, you could tell me, but do you really think it's because of her teeth?
You know, I'm just a tool. She's the one that made the decision to improve the smile. And I think she
because of her
gained
self-confidence.
Yeah, and I think she gained confidence from that, and I think it didn't hurt. Let's put it that way.
I mean, look, I mean, there's no doubt about it. Because I was, you know, a dentist. You come on here before. In fact, when I first met you, I thought you guys are exaggerating sometimes. But I think anybody, even at home, can look at this. The after, she does look more sophisticated, more refined.
Oh, absolutely, and
more professional,
more professional,
more credibility,
more beautiful. It's
okay. So
it's all
good point. Good
yeah.
point. Okay, so she got promoted because of it. All right. What else do you have going on here?
Well, the next one I want to show you. This is an intraoral photograph. Might look a little scary. Missing tooth, and this one has a really interesting story. This guy is a local DJ, and so on the radio station, his cohort is constantly harassing him about this missing tooth. He says, I'm sitting next to you, and you got this goofy tooth. And so one day, one day he calls me one day he calls me from the radio, and they had warned me that they were going to call me about it. So I was, you know, live on the radio. I knew the call was coming, but he says, Dr. Brewer, he says, can you do anything for this guy? And
on the radio,
and oh, this they you know, banter amongst each other, and I says, yeah, and he says, and so he's asking me, how important is a smile? And I said, well, you know, when you're in the public eye like this guy is, I said, it's incredibly important, but it's important for everybody, but of course, and I said, of course, as a dentist, I'm going to say that.
Okay.
So I want to let you look at his before, his full face.
All right.
And wait till you see the after. I mean, it's dramatic difference. You can't have a small town celebrity looking without that. So he's a cool kid, and we enjoy him, and
is that
it was fun to be part of that.
There's a lot of people that have smiles or teeth that their buddies make fun of them.
Absolutely.
So your message is what? Just do something about it. Go in.
Well, and his buddy, you know, actually took a role in it. You know, he cared enough about him to harass him into it. So between the radio station and myself, little insurance here and there, we got something put together for him.
About veneers and cosmetic dentistry in general, when you're on the consult, what are the frequently asked questions? Like, what do they want to know about the process?
They want to know how long it'll last, whether the procedure will be painful.
So when they ask you how long will it last, what do you say?
Well, I give them examples. I tell them, you know what, I've got front 10 veneers. So I've got enough confidence in it myself, and I've never had a single problem. If they take care of it, they brush. Some people will need to wear a night guard because if they're grinders. But you know what, for the most part, they could last a lifetime. And mine have been on for 10, 15, 20 years. And
so you have good looking teeth.
Yeah.
And they don't stain. I mean, veneers don't stain.
They do not stain.
Nice.
We'll be drinking a nice red wine, and I'm noticing some people's are getting pretty ugly, and mine are still nice and white.
Their whole mouth is purple, and yours are good. You know, what are your thoughts? And this is way off track, but a dentist that doesn't have good teeth. I mean, when you look for a dentist, do you think the dentist should also?
Yeah,
I think they should walk their talk in all areas.
It's not a good It's not a good advertisement, is it? The physicians that smoke, I don't get into that.
So look for a dentist with good teeth.
I think so. Look for one that has had a lot of experience in all these different types of restorations too. You really don't want to.
You think the public doesn't know? I mean, look, you know, I was talking to you, and you say, Randy, I mean, you're always going to ongoing training. Is there really that
constantly
much to
going
learn about this stuff?
You know, there is, especially if you're in an office like we do that does everything. I mean, if you're doing implants and sedation and cosmetic dentistry, you better be out there constantly learning. We are trained in advanced cardiac life support.
So experience matters, by the way, when it comes to smiles? I mean,
oh, absolutely.
I mean, it sounds obvious, but it really does make
it. Yeah, I mean, go to somebody that's done thousands of these restorations.
You've done tens of thousands?
Tens of thousands of cosmetic restorations, absolutely.
And somebody watching this, okay, they can call same day. I mean, this is what your reputation is.
Yes, call the same day and we'll get them in that day, guaranteed.
Really?
And I've had people coming in, literally missing every other front tooth, and sedate them that day, and they leave with a temporary smile, come back a week later, and we put in the permanents. And we just did that.
Rare.
We just did that a month ago.
I mean, that's got to be rare. Same day.
You don't see that in dentistry. You know, and I was at dinner last night with some of my wife's relatives. She has relatives here close to your studio. So we're out to dinner, and one of the guys says, "Oh my God," he goes, "I had a horrible toothache. It needed a root canal and a crown." And he says, "They told me that it couldn't get in until 2 weeks." Well, these are the type of patients I'm taking care of. I'm getting them in, taking care of them that day, guaranteed.
Is that right?
So it's
and this goes for all the different procedures,
yeah.
dental implants,
right.
I mean, whatever.
And even with that, we have a computerized program where we guarantee, this isn't a guarantee that they'll be seated exactly on time, but this is an inter-office thing where we monitor the success rate of seating a patient on time. We're allowed 5 minutes, and most of our practitioners will be in that 96% range for having that patient seated within 5 minutes of their scheduled appointment.
You know what? You know, and this is your company. I mean, this big dental, you know, what do you call it, by the way? Dental office?
It's a dental clinic.
Dental clinic. Okay.
Yeah, it's a
behind your back. By the way, we were talking about you, and they were saying, "Oh, he's a stickler for being on time. He doesn't like people that are late." So
that's true.
So the doctors have to be on time. So when they go, you promise them you're going to get them in at a certain time. I mean, you do your best to get them in at that time.
Yeah, we virtually do get them in at that time. The nice thing about our clinic has 19 operatories, so there will always be operatories that don't have a patient sitting in them, and then we have a large enough staff that we can get that patient seated on time. We can do some of the preliminary things. So if our other procedure is running a little over, we can still make progress toward getting that person started on time, and it works well.
Okay, good. And for somebody that they go in, their mouth is a disaster, et cetera, How much say-so do they have in what it's going to look like? I mean, do you have imaging? Do you show? I mean,
we absolutely do. We have imaging. I think it's Snap is the brand, but we'll actually go out to the home improvement shows and stuff where they'll have a health show, and we'll take part in the health show, and we'll show people. We invite people to get a before and after, so we can show them exactly what their smile could look like.
Pretty accurate, by the way, with this imaging.
It is. It's very realistic, and we do it at bridal shows. It's kind of labor intensive, but I think it's a positive thing.
When did you know you wanted to be a dentist, by the way? Because you don't look like a dentist or even act like a dentist, by the way.
Hey,
when did you know?
You know, I grew up on a ranch, and my mother always told me I'd be a doctor, lawyer, or veterinarian. And went out and I interviewed doctors, lawyers, veterinarians, and after a while they said, Kevin, you know, just talking to you, I think you're excited about dentistry, and they all pointed me that direction.
What do you like? I mean, are you surprised? I mean, did you expect to like it this much, by the way?
No, I didn't. I thought it was going to be more of a job.
What surprises you, by the way, still, after all these years, weekly, about patients?
You know, I'll walk down the hall, and my job is so great because it's so rewarding. I'll run into one of the other doctors, and we're just both smiling, walking down the hall, and we just look and we say, isn't it great to be a dentist? I mean, it is.
I mean, you guys really say that? Really? Good for you.
Yeah, I didn't, years ago, prior to putting the big group practice together, I didn't feel that way, but we've got such a team spirit, and we study together. It's really cool.
Okay, good. Now we have time for a few more.
Yeah,
let's look at that. Let's
look at these.
Sail through these.
Yeah, you know, successful businessman. I want you to look at the before. He was actually concerned about one tooth, one crown that didn't match, and I said, you know what? Let's just look at them all. I said, let's just do minimum the front 8. So if you look at those two, the before and after, side by side. My staff look at this gentleman and they go, wow, that after picture, he is one good looking guy. And
now, and by the way, because his mouth is turned down, do you think that that will change? I mean, a person that isn't used to smiling?
Well, yeah, and I mean, we've got the inner lip space that, once again, every one of these photos, larger inner lip space when they're showing
Meaning showing more teeth.
Showing more teeth. Every single one of them after, they're more proud, and they smile. Remember, a smile isn't just the teeth. They're smiling with their eyes. They're smiling with their whole face. Makes them more positive, and I'm pleased with this case. I show his case off in the office quite a bit because I think it's a beautiful case, and he made the right decision. I'd like you to look at this. We're not going to talk much about this one, but people say you've always seen worse. Well, this is one of the worst I've seen in the last year. So what I want you to look at is a really bad case, and I mean, and this is a good-looking guy, and obviously he didn't smile when he came in. So what I want to show you next is what we did for him. And now this is actually a denture with implants, because I don't feel that dentures, at least on the lower, are satisfactory at all without implants. So I want you to look at the after, and then let's go ahead and look at those at those together. Is that a night and day difference?
It is, it is.
And I didn't want to show the full face on this gentleman because I don't know, I'm just not.
How many years does a guy go with those dangling teeth, or they appear to be dangling to me?
I'm saying he probably looked that way for 5 to 10 years, but
doesn't smile at all.
He's just a great guy. He's a friend of the practice. It's been absolutely life-changing, I'll guarantee it. And I want to show you just a model. See, a normal denture will just fall off. A lower denture floats. There are snaps. These are implants.
Like 2 implants.
So the day the teeth come out, the implants are put in, boom, these snap on. And I think that's the only way to do a lower denture.
Is that the future, by the way? I mean, all dentures in the future, in your opinion, will probably be held on by some
lower dentures, in my opinion. I'm just about to the point where I won't do a lower denture without implants.
And you guys do also that teeth in a day kind of concept?
Absolutely.
You'll do it that day? Is that right?
Yeah, the dentures are built in advance, so the teeth come out, the implants go in, boom, they're snapped on.
Okay, good. Okay, good. What else are we looking at here?
So here's a gentleman that had maybe some of the more significant problems that we've seen. He didn't smile, he had pain, he had one tooth that was broken off and dangling, so he was about to miss a front tooth, and that's what ultimately motivated him. Sometimes people have to get to a point where they'll let everything go to heck, but when the front tooth is about to fall out,
they come in.
Then they come in. So now what I want to show you the dramatic after and watch the different smiles. It's just absolutely
the guy's got to be thrilled, obviously.
Yeah, he is. He thinks a lot of us. We think a lot of him.
It's like a new lease on life, I mean, for somebody.
Yeah.
I mean, the smile's right in the middle of your face.
Yeah.
I mean, it does. I mean, it is important.
He spent an enormous amount of money, and I'll bet you that he would probably spend double that realizing the benefit he's got now. It's just incredible. Okay. You know, I want to show you that the people around me believe in what we do. So I want to show you Tammy, hygienist that's been with me about 15 years.
It's a pretty good looking smile, though.
It is a good looking smile. She's a good looking girl. Her teeth did have wear. They had old fillings. They were chipped. The teeth were looking worn and old. So now I want you to look at the after, and then look at them side by side. What you'll see is a far more beautiful smile.
Well, very flat, I guess, in the
absolutely. They start to wear down, and they start to show the age.
She actually kind of looks a little hip and up to date and stylish with those new set of teeth. I'm not.
I'm not trying to side with you.
I'm not trying to side with you.
And this is another case. You were asking about longevity, and I did her case long ago. Most of these cases were all done in the last year, but I wanted to bring in a couple that I'd done a long time ago. Tammy hasn't had a bit of trouble with any of hers.
Okay.
Now here's my daughter. Once again, hers was done quite a while ago. You can see she called them her baby teeth. And another thing that she was concerned about,
smile,
it is, and she was also concerned about the gaps at the edge. In other words, because they weren't out wide enough. They call it the Julia Roberts smile. She didn't want to show the gaps, so we wanted to fill that in.
So there's kind of like black holes.
The black holes at the corners. So now if you look at her after, they're a longer tooth. They look more adult-like in her mind. And she's in medical school now. She's going to be
good for you.
A doctor.
And by the way, is she the one that noticed that stuff?
Yeah, she's the one that pointed out. She came to me and she says, Dad, I think I want veneers.
Okay.
Because her brother had them, and she saw what we did for her brother.
You give her a discount?
I did a pretty good discount. Yeah.
Okay.
So this after photo was taken by the same day we put the veneers in, because she had to get off to college, and then she and I had our picture taken together.
Oh, that's nice.
So she and I had our picture taken together, and that was once again the same day we put the veneers in.
That's good.
That's pretty cool.
You know, we are out of time, and final message, by the way. Somebody, they don't like their smile. What's their first move, in your opinion?
Come in.
They think there's no hope.
Yeah, come in and get a consult. There's nearly always hope, and the thing to remember is, in nearly every case, it's totally worth the investment, and they won't regret it. They'll be so happy they did it and wish they'd done it sooner.
Okay, good. Well, thank you for coming on the show.
Thanks,
Great stuff. Great
Appreciate
photos.
it.
Are these on your website? They could go to your website and see all these photos. Is that right?
Absolutely.
Okay, good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website and just put in Dr. Brewer or cosmetic dentistry, and you'll find it there. For now, I wish you good health.